Good morning, friends, and welcome. Happy December 13th. I hope you're all doing well and staying warm. We're going to go ahead and get through our roll call in our minutes. So if you'll just let me know that you're here, that would be great. I'll start with Kelly. Norma, I see you, Norma, on the iPad.
Here. Yep, here.
Hi, Norma. Michelle.
Hi, Stephanie.
This is Michelle. I'm here. I'm just driving, but I'll be on in a little bit.
Got it. We see you. Thank you, Michelle. Ashley Chase. Anna Cole.
Here. Excuse me. I too am driving, but I'll be on camera shortly.
Good morning, Anna. Jenna.
Hi, I'm here.
Hi, Jenna. Brian.
I'm here. I'm just finishing my yogurt. Sorry.
All right. Enjoy that. Dennis. Janelle. Dave Hayes.
Hello, good morning, everybody. I'm here. Dave Lee.
Hi.
It is.
Good morning, Chelsea.
I'm here.
Great. Kevin.
Good morning, all.
David. We have David Lee. Sorry, I think I messed that up. David Lee, we know you're here.
Yes.
Great. Dave Hayes, I do not see. Okay. Renee.
Hi, I'm here.
Good morning, Renee. Beth, my co-chair. Hi, we know you're
Good morning.
Hi. Brandon, we know you're here. Becky is in her ski sweater. She's ready to go.
Good morning.
Elizabeth, we know is here.
Yeah.
Lynette. Timothy. And Jana.
Here.
Okay, yes. Good morning, Jana. All right, that is my job. Is there anybody I did not call? Anybody, member of the task force? Okay. All right, I get an A. Moving on to our agenda. It is a bit more complicated than usual. As you will see, we have 3 different sets of meeting minutes. One set of meeting minutes, and these are all for the November 1st, 2023 meeting. One set of meeting minutes for all the group discussions, one set of meeting minutes for the intervention subcommittees, and one set of meeting minutes for the prevention subcommittee. And so I'm going to ask all of you just to, for those of you to remember your subcommittee assignments, and I'm just going to be asking you if we need to do some changes to those. So I'll start first of all with the intervention subcommittee, of which I know we have some folks here, hopefully. Who's on the intervention subcommittee? If you could just raise your hand for me. Great. Okay, well, we are relying on the couple of you. If you have any edits or any sort of corrections you want to make to those meeting minutes.
No, I couldn't think of anything.
Okay. Becky?
Me either. All good.
Okay, great. And at the same time, I'm going to do the meeting recap for the intervention subcommittee as well. Any edits to that from members of that group? Okay, I don't see any. I see head shakes. No. Okay, fantastic. Then I would like to go ahead and move for passage of the November 1st, 2023 intervention subcommittee meeting minutes and summary recap. If I can just have a quick motion from our couple folks.
This is Norma. I make a motion.
And this is Brian Cotter. I'll second.
Great, thank you all. Everybody, anybody opposed to passage of those meeting minutes for the intervention subcommittee? All right, I see none. So we will proceed now to the prevention subcommittee. For members of that group, do you have any edits or corrections to either the prevention meeting minutes and or summary recap? Okay, I see head shakes no. All right, those look seemingly okay by our group. If we could have a motion and a second and get those approved.
I'll make a motion to approve those minutes for the prevention subgroup.
Thank you, Dave Lee.
This is Jenna. I'll second.
Thank you, Jenna. Anybody opposed to the passage of the Prevention Subcommittee meeting minutes and meeting recap? All right, thank you, friends. Appreciate that. And then finally, just looking at the large group meeting minutes. Are there any additions, again, edits that this group would like to see to those meeting minutes? Okay, I'm seeing nothing. Head shakes no. All right, if we could have a motion and a second to pass those meeting minutes, please.
I motion. Brandon.
Thanks, Brandon.
Beth, I'll second.
Thank you, Beth. Is there anybody opposed to the passage of those big group meeting minutes? Great. Okay, thank you. I think my work is done here, Trace.
Yes, thank you. Thanks, y'all. Appreciate it. We've got a 2-hour meeting today, which means we don't have a ton of time, but we have a lot of work. So I think that's typically how it goes. So welcome. Excited to see you all here. I know we had a couple folks jump on, and looks like we have a couple members of the public. So welcome, and over kind of a big roadmap around where we're going moving forward, because we are making a strong pivot into a very specific framework of how we're going to march towards this final report and any recommendations. And our main tool to do that are these subcommittees. And so we have a little bit of a roadmap to kind of lead you all through of how we're going to get where we need to go. We want to make sure that that's super clear to you all, so you'll know what each meeting will be covering. And I think this is going to end us up in a really great place. So just a shout out to Jordan for kind of doing some of this outline work in a way that I think is going to make a lot of sense. So Jordan, if you wouldn't mind screen sharing, I put together a slide. So as you know, each of you.
Trace, just getting permissions really quickly, and then I'll catch up.
Oh,
with
you're good. Yeah. Let me do. I'm not sure if Karen put here. I just put them on. You should be good. So as you know, each of you are either in the prevention subcommittee or the intervention subcommittee. We talked to a couple of folks about switching to make sure that we have kind of equity of voice around different topics and different challenges. Otherwise, at this point, you should be sticking with the group that you've already been in. And so I will be sticking with prevention, and Doris will be sticking with intervention moving forward, unless we decide to do a change up. Who knows? Anything's possible in 2024. And so I want to go over the topics again, how we got to these topics. All the conversations leading up into these past couple of meetings, the surveys, the breakout groups, the note catchers, the conversations, we were able to distill down into these topics for each group. I want to be super clear. This does not mean you cannot go anywhere else. It means that this is where we're definitely going. And as other topics come up or other things come up as a kind of almost a sub conversation as a part of these, our job is to then capture that as it reflects in the report, that this is something that the group was interested in or decided to do recommendations around. But we do need to have a bit of a roadmap to definitive places. So that's how we determine these topics. So with prevention, just go back real quick. Sorry, Jordan. With prevention, that's screening tool, hardware, uses of restraints, and education on the risks of running. And then intervention, that's the statewide absconder unit, standard statewide response policies and procedures, temporary housing for recovered youth, and education on trauma-informed recovery. So you might be looking at these lists being like, wow, Trace, how are we going to do all of this? Well, let me tell you. That's right. That's my like OxyClean voice. So go to the next slide, Jordan, and I'll start taking you through. So today, December 13th, we're basically going to oscillate between meetings being subcommittee meetings and then full group meetings. And I'm going to talk you through how we're going to do that. So subcommittee work, we're going to have one topic that's going to be assigned to each subcommittee group for that meeting. We chose a cadence. I don't know if there was a huge rhyme or reason, but basically we just spread them out over the next X amount of months. So today, screening tools will be in prevention and absconder unit will be in intervention. You've been provided a ton of resources. We've had a number of conversations. We're going to be asking some critical questions around pros, cons, considerations. a little bit deeper than that, but that's kind of the general gist of it. And then when you come back in January, your subcommittee will be in charge of not bringing together the subcommittee doesn't have final say on the recommendation, but the subcommittee does have the task of bringing forward the conversation that they had, the recommendations they might have to the group to consider. And if we have recommendations to be made, we'll then vote on those and we'll move forward. So I think the thing I want to just reiterate is that February 14th, you don't see a review of absconder unit, you see a different topic. So we will have moved on. And that's a super intentional piece that we've just got to start marching forward, because this will be wrapped in September. We have a number of directives to get to, as you all know. And so this is kind of our approach to doing that. So go back, sorry, one slide, Jordan, I just want to make sure. So again, you've got subcommittee work today. We'll go into the full group where we'll review that subcommittee work for absconder unit and screening tools. Then February, we'll go back to subcommittee work. We'll break down statewide policies and hardware, and then again, come back. April, we'll go into temporary placement restraints. And the next slide, we'll go back to reviewing subcommittee work for recommendations. And then we'll go back into subcommittees, education on trauma-informed recovery and education on risks of running. And then we'll go back for the review of the subcommittee work. We've set aside 2 meetings really around, we kind of just said high level, finalize report. I think that's a lot of things. We could be in a number of places. I know we will be in a great place around any recommendations this group wants to make, but really we want to set aside 2 meetings fully for you all to have discussions around kind of where we've landed as a whole group and what recommendations are being made. So with that, before I kind of talk conversations within the subcommittees, want to make sure that Doris or Jordan or Stephanie, if I'm forgetting anything, or if y'all want to highlight anything as far as the actual kind of roadmap piece of this.
No, Trace, I think you've covered it. Just to reiterate, at the end of each subcommittee meeting, we'll be seeking a volunteer from each subcommittee to help us produce a packet that will go to the full group. So we're going to need some help kind of putting those things together and getting those ready.
Hey, Jordan, can you say more about that just so people understand what the commitment is? Like, are they going to have to write a 60-page memo, or are they just sitting with you and Brian and smart people for an hour? And
no, I'm happy. It's not 4 hours, I promise. What we're going to be doing, Trace sent out note catchers for each subcommittee, and you're going to see that those questions are pretty pointed to the topics that we've included. What would you like? What wouldn't work? What examples would you like to take from other states? So to Trace's point earlier, subcommittees don't have final say on whether a recommendation moves forward, but we just need a volunteer to come work with Brian and I, probably for about an hour between today and the full group, to make sure that we're putting together a summary of that work, what's in the note catcher, so that when it's presented to the full group in January, we know how to present that, we make sure we have everything covered, and we can lead right into those discussions of refining that and deciding as a full group how we want to move forward with that recommendation. So it'll be about an hour commitment between the 2 meetings.
A liaison, if you will. Go ahead, Doris.
And then would that person then have to present something to the task force in that January meeting, or are they just helping to prepare the documentation to go out?
That person will be one of the first people to present the document, and then the full subcommittee will be present for questions.
A fireside chat, if you will, Doris, one of our favorites. Any questions from task force members as far as the cadence of the meetings, how we're thinking about that? Okay. So the other thing, if you want to take off the screen, appreciate that. And again, we'll share that out with the group so you all have a reminder. And, a couple things I just want to reiterate. One, the emails are more important than, oh, Brandon, go ahead, Brandon.
Yeah, just for the prevention part, where would like fencing come up, like in those 4 topics?
Jordan, I'm seeing a head nod. Do you want to?
Yeah, great question, Brandon. The fencing, delayed locks, that's all going to fall under the hardware portion. We just gave it kind of a broad name. Between now and our next meeting, I am going to do kind of a big inventory for everyone. It'll be kind of a primary sheet that has a better description of each of the topics you're going to see. And then I'm going to work to kind of categorize all the information we've given you that go to each topic. So you have kind of a quick reference guide, but fencing, delay blocks, anything that would constitute a hardware adjustment would go under that discussion point.
Thank you.
Yep, great question. So I guess the other thing to say then is, as we kind of build that out and make sure that you have all that you, I mean, you got a version of that for today's topics, right? And all the materials that we sent you, you'll get kind of a more roadmap version of that. So you kind of know moving forward, and you have time to review those and ask questions and ask for additional if you need something you feel like you've asked for that you haven't gotten. So I was just gonna say a couple of things to remember as we go into these groups. So one is, the emails that we send out will be the spot where all of these materials are starting to be organized. And so just want to emphasize to take the time to read through all that. I know it kind of has been mundane of like, read the minutes, review this, review that. But there will be a lot of information in each of the emails leading up to each of the meetings. And so I would hate for us to get to a meeting and someone be like, I haven't had time to review. You will have time to review. We are committing to at least 1 week in advance for the materials, if not more. And as we do some of this mapping work, you'll have a lot more of that in advance. So if you have a concern around the timeline, reach out and let us know. We're doing the best we can to get things out, in a timely manner, but we also need you all to be sure to kind of do that homework so that we can really dive into each of those conversations in the subcommittee meetings. The subcommittee meetings, the biggest thing, and you all know this, but I just want to reiterate, like, we need your participation in this, and we need these conversations to be, you all are here because you all represent different entities, different experiences, different perspectives, and we love that. And so we want your participation, and we're counting on your participation. And so just want to encourage folks, if you can, be on camera for those meetings, for the subcommittee breakouts, be involved in those discussions, push folks. This is not a place to just kind of sit back and listen and say, oh yeah, thanks for bringing that up. Sounds good to me. This is the place that if something is on your mind and you're feeling like you're not getting into, particularly as it relates to your unique perspective, speak up and say that. We had some really great conversations in prevention last time, and I kind of love that push-pull dynamic that we see sometimes in groups where people say, well, I don't feel like you're considering this. Like, that is the heart of this kind of group right here. This is kind of the time to wrestle with one another, respectfully, if you will. But we're excited for those conversations. So just want to encourage you all to be active and engaged in those groups, because that's why we're splitting them out, to get us out of this big group so that you all can really go deep on those. And again, in order to go deep, it's probably less questions and more conversation based on the resources that you've been provided. So we're not seeing the subcommittees as a time to just kind of like unearth thinking, more like you've done some of that thinking, you've done some of that research with the materials provided, and now we're doing that work. Because again, we're not going to be able to revisit these topics once we move on. We just don't have the time. So I just want to make sure that I'm emphasizing that and making that super clear. Doris, anything that you would add as far as on the subcommittee works and how we're thinking about that?
Nope, I think we're good.
Cool. Okay, so with that, I'm going to stop talking. We are going to do similar to what we did last time, which thanks, Jordan, for dropping those in. You've got the prevention folks dropped into the chat, and then we're also going to put in the intervention. Intervention is going to go to to another link that we're going to drop into the chat. So we're doing that just because sometimes you can record in breakout groups and sometimes you can't. So we would rather be super safe on that and make sure that we're able to record, because that's super important to us. Members of the public, you are welcome to stay either here or click on the link and head to the intervention group. Again, Doris will be convening that group, and I'll be here with the prevention folks. We will have an hour in those groups, so to 9:30, and then we'll come back. Doris, you and I can just be in communication. If y'all need a little bit more time, just let me know. But ideally, we come back and just do some high level kind of what was discussed in those groups and any lingering questions you have. Each group, again, has note catchers. We have those links. We'll drop them in once we get into our rooms. And in those note catchers, again, the themes are if you could, pros, cons, considerations, but we have a little bit more specific questions to really dive into what we should be taking away so that we can then shape that up into potential recommendations. Jordan, anything to add?
No, just these lists of intervention they don't reflect the members who we've asked to kind of move around for voices. And just that note. So I'm going to drop the Zoom link for intervention. Just give me 30 seconds to get off this call and go start it. And then I will see everyone over there.
Perfect. All right. So dropping the link, give it a minute, and then she'll be there. And then prevention folks, you are staying here. Again, members of the public, y'all can jump off or stick on for prevention.
No subcommittee ACDC walk-on music.
You know, I thought about it and I was like, I don't want to introduce chaos again. All right, I think this leaves us. Is everybody in here in prevention? Looking around. Yep. Okay. David, I know we only have you until, what'd you say, 8:45?
Yes.
Okay, cool. So I'm gonna drop in. Excited to work with y'all, by the way. We've got a lot to do. So you might have to pause me here and there again and say, okay, let's have a conversation here. But I want us to I want to give y'all props. We had a great conversation last meeting when we broke into the subcommittee. So I'm really excited for the level of thoughtfulness and questions and willingness to just be a little bit vulnerable with one another around what you'd like to push forward, what you're thinking through. So just want to keep that spirit here and just sharing some gratitude with each of you. With that, getting into pre-admission and recovery screening tools, I'm going to drop in the note catcher that we're all going to be working from today, because again, this is not to exclude a conversation, but this is to get you all start generating thinking. And so that make sure that everyone kind of has the opportunity to give some input. And then I'm going to start pulling out some pieces that I see dropped into the note catcher so that we can kind of talk through them. And you know, if I'm seeing things that need to be wrestled with a little bit, but really, or if I'm seeing themes, but want to give everybody a chance to kind of jump in that way. First, I want to ask, as I'm dropping in the note catcher, any questions, feedback on the resources that were provided for you? And Brian, before you say that, Brian, can you give a quick overview? I know folks have already seen it, but if you could give, I'm talking less than a minute, overview on just the resources that were provided as kind of a refresher for folks as what they were looking at.
Yeah, for sure. So this was largely inspired by the positive response to the Vermont speaker we had come in and talk about creating specialized response plans to prevent youth from running away. So this resource that we prepared talks about what regulations look like in Georgia, Nevada, and Wisconsin, which are largely, once a youth has run away and then been returned, developing an understanding of why they ran away, what the forces were that either led them to run away to something, or that they were running away from the place they were or running to the place they wanted to be, and then adjusting what their care looks like to prevent the next runaway from happening. And then we also included Illinois, which has an assessment user guide, which is more at the beginning. So it's sort of the pre-admission screening to find out what the needs are for the youth, and then to build a plan around what can be best done to keep the youth from running away. And then again, we're not asking, we're not endorsing these state policies, but we just think that nuggets can be taken for what might work well in Colorado, what might not work well in Colorado, just something to kind of sink our teeth into.
Thanks, Brian. Appreciate that. Any questions or feedback or just kind of initial thoughts on some of those materials that you were looking through? Go ahead, Stephanie.
Yeah, thanks for the question, Trace. Yeah, Brian, I have the materials. And I guess, well, we still have Brandon, and I don't think anybody else in this group has to leave early, but we have Brandon for 30 minutes. And Brandon, there were some really interesting, I think, concrete forms, templates, and even the Illinois very large risk assessment user guide and would just love to get some of your comments on those concrete things, and not necessarily a critique of the items themselves, but just conceptually what your thoughts are. And then, of course, I want to hear from the rest of the group. But Brandon, I just don't want to lose you without having a bit of that conversation.
Same. Sorry,
Yeah.
Sarah. David also has to leave too. So David, that
Oh.
would be good for you as well.
Great.
Go ahead, Brandon.
Yeah, no, I think screening tools are great tools. I think Colorado has, underdeveloped, if not any, in certain areas that we should have. So in this area, I am a huge advocate for screening tools and individualized plans regarding to it. Now, which one we decide to do, or if we're going to do it, I think is, probably the more difficult, aspect of it, but I think they're excellent tools. The more information, the better around at-risk behavior. So that's kind of my stance on it. But I also want to just make one comment too. I think when we talk about like the focus of runaways, I think, oftentimes we go into, the whys and the, why kids are doing these things. And in my experience, at least in our world, in the PRTF world, more times than not, motive is not, really like the issue. Like as far as like kids don't a lot of times know why they're running. And I would just be remiss to say, like, if we're focused on that, there's a logical reason to a lot of running, and as our information, and that's what we're centered around, we tend to, I tend to get kids that, that's a trauma response and they just don't know why they're doing it. And so I don't think we should limit it just to like, we're assuming kids have motives around some of this stuff. If that makes sense.
Yeah, thank you.
I was just gonna say, putting a pin in the kind of the not the outlier, but the piece on the trauma informed piece, right? So like knowing there's not always I'm hearing from you like there's not always an answer as concretely as folks would want. But David, curious to kick it over to you.
I haven't had a ton of time to look at some of these. I mean, I was glancing at the one from, I think it was Illinois. I mean, when I think about some of these prevention plans and these assessments, I mean, my big thing is to ensure that they're validated and that they're, however they're created, that it works for Colorado. And it actually identifies truly what we're looking for. That's where I look for that validation. Like somebody's actually taken the time to assess that tool and ensure that it actually works and it identifies what we're really looking for. I have a strong feeling there's a lot of agencies that probably in their own way assess many youth that are a risk to run away. And I mean, I'm curious about a tool that will help us anymore. I mean, I look at just with DYS or even kids that are in placement in QRTPs and foster homes and go, I can only imagine the risk to run away is extremely high. I mean, I'm looking for something, tell me something I don't know. Help me with something that I don't already know when it's a risk to run away and assessing. I'm looking more at that's why I'm in this group around the prevention piece. I think a large number of our kids are at risk. How do I prevent it? Because I can assess so many and it's going to come out as a high number, probably well over the 90% that are in out of home placement are risk to run away. Now, help me prevent that. Give me some tools to do that. And I'm not trying, I mean, honestly, I'm not trying to be negative. I'm just trying to go, tell me something I don't know. Help me with something that I'm struggling with right now. I look at how this will help collaboration amongst a variety of agencies, transparency, whether it's county departments and the ombudsman's office, law enforcement agencies. I mean, everybody should be working together to help prevent these kids from running away. And when they do, how do we get them back and provide them the resources and the tools when they get back so it doesn't continue to happen. So my thoughts, you guys know me, I can ramble on for forever here.
Oops, Trace.
Yeah, I'm on mute. Sorry. I was going to say, I appreciate it, David. And I know since you're leaving in about 10 minutes, would love for you to just kind of pause. We're going to continue the conversation right now, but I dropped in the note catcher and would love for you to start populating some of that from your perspective, some of what you just shared, but also going a little deeper on some of those questions. Would love some of that input before you step out. Brandon, then Brian, and then Jenna.
Yeah, just to kind of, expand on what David's saying, but like, I think right now, a lot of facilities and organizations evaluate risk of running by just the numbers of run. And I think that's the wrong measurement because kids are going to act out in a particular way, whether it's aggression, it's fight, flight, freeze, responses. And I think what an assessment tool can do is provide, if you're smart about it, and I agree with them, it's got to find the right, whether we got to create one, whether we got to, find one. It's finding the right information that is going to help, facilities not, deny kids that actually, aren't going to be an issue if provided the right, treatment, or that aren't getting looked over because they're having a response to, difficult time periods and things like that. And I think this is where, information can help you because you don't always get in the referral the information that is needed. So you just go by, oh, this kid ran 10 times at his last placement. And then I might deny that kid. And then that kid's not getting the treatment that they need. When in reality, there are pieces there, and that's just a response rather than, this kid is intentionally trying to run away from things, if that makes sense.
Thanks, Brandon. Brian, and then Jana.
Yeah, I'm here all day, so I'll be quick. I just wanted to say that for a lot of those states, the kind of the assessing was like step one, and then the step two was often tailoring the individual treatment plan. So like the example given in Illinois was from a hypothetical that they provided was using like authorizing the use of physical restraints on a particular youth based on the information that was ascertained from the assessment plan. And I think that just thinking back to the interest in Vermont, there's a lot of interest in how the assessments used there informed the stop orders for the actual physical prevention. So it's not just the gathering of information, but then in these states, at least, it's putting that information into application in altering the kind of care they're receiving.
Thanks, Brian, for that additional context. Jana, and then I'm going to pause us so that we can get into this note catcher and start populating. Go ahead, Jana.
I've just got three kind of comments. One is I totally agree that kids, particularly in trauma and emotional situations, having lost their families, etc. I'm a foster parent, by the way. They don't have a motive that they know of. But I will say from my experience, after I talk to these kids after they are in their 30s or late 20s, they do know why they ran away. So I would love for us to maybe search out, not at the time, but if we're looking for why are these kids running away, we need to go to the older kids that have been able to process their emotions, their behaviors as with a more mature brain. I did talk to a young man who had run away since he was 13. He'd been placed in many facilities, many foster homes. And I said, give me the number one reason. And he said, the placements were not a fit. They didn't care and they didn't understand me. And I totally agree with that. Now, here's the hard part of that is foster homes and placements are so hard to come by that we accept substandard placements. I think that's, we just go, well, this is the best we can do. Instead of really focusing on creating a wider range and better quality of foster homes and placements. We took two girls from a foster home who later, these girls reported abuse. We reported the abuse to the system. It was founded. And then this family was given 5 more foster kids a month later. To me, this is unacceptable and it scares me to death when I know that goes on. So I think our focus needs to be on quality placements. Then the other thing I want to say is when you talk about screening the kids, like here's their behaviors, new foster parents or new, I can't tell you. I would say about half of the kids that we've gotten, and we haven't had a ton of kids, like some people have hundreds, but I would say about half the kids come with, once they're placed in our home, have opposite behaviors of what they have been screened and we have been told. So I think kids respond to their environment a lot of times, not always. And so those are the things that I've been thinking about these last few weeks is let's go to the source. Let's find out what mature kids who've run away feel. Let's hold our placements accountable for bad behavior and let's screen them better, give them more training, really do really try to seek out some good families.
Jenna, I appreciate that. I want you to channel those perspectives when we start populating this note catcher, because I'm hearing you as a focus within the screening tools that perhaps there's an element around the fit, right? Or perhaps there's an element around, you were talking about the behavior piece. Obviously, that's already an element piece, but how are we actually considering that when it's not an immediate behavior, those sorts of things. So I'm hearing what you're saying, and I appreciate that perspective a lot, particularly as like you shared you're a foster parent, so you're in it, right? And you're seeing these, and you're kind of thinking, okay, what would actually be helpful for me as a foster parent in this situation? So certainly don't want to cut you off from sharing that perspective, but also want to make sure that we capture that in this note catcher as part of your kind of lens of what to consider when making recommendations around screening tools. And also I'm hearing you on the quality of placement being a priority for you as a foster parent. So just putting a pin in that and looking at where else in our conversations as we continue forward might that fit, if there's an opportunity, or if that's just a way that we can capture that this group makes a recommendation around considering future work, right? And focusing squarely on that as a need as well. So those are the couple of things I wanted to respond to. But with that, I want to just pause. And I want to give us all an opportunity to start generating some of our responses in this note catcher. So if you, I dropped 2 links in. I dropped the note catcher in, and then I dropped the materials in. The materials are what you were already provided in the email. So it's just if you want to reference back something, and if you're thinking, oh, I wonder what that was, that's where all of those materials live. But I want us to all turn and focus on this note catcher right now, because what I want to start doing is we don't have a ton of time, and what we need to do is start to surface where the themes are. I'm seeing some head nods already on some of these comments, and I want to get them down on paper so that we can actually take that and have something to come back to this next meeting with. Again, the biggest thing here is they're on the note catcher, you'll see 2 sections. One at the top, these are important. One is opportunities, and 2 are challenges. I want you to put the challenges on the shelf for a minute when you're talking opportunities, and not be thinking about, well, that's not possible because X, or I don't even think that's a good idea because Y. Again, in the spirit of being bold, in the spirit of what's possible in this group moving things forward, think about this as what are the opportunities? What would you like to see? And not be thinking about what those challenges might be. Then when you go to the challenges section, which is the second page in the note catcher, that's where you can lay it out around what considerations we might have to consider as a challenge when you think about the implementation of your ideas. So I just don't want your challenges to get in the way. So again, put them on the shelf for a minute, and let's just stick in the opportunities piece for now. And I'm going to give us 15 minutes in that. So at 9 o'clock, we'll come back. I might pepper in some questions as I'm kind of pushing you all to go deeper in how you're talking about this in the note catcher. But otherwise, I want you all to just sit and do some work right now and start generating these ideas here. Anything to add, Stephanie? I just know you and I have talked about this a ton, so I just want to make sure I'm not missing anything as far as you're thinking from the perspective of the chair. Okay, cool. All right, y'all, we've got 15 minutes. Again, we're sticking in the opportunities, and we're pausing on the challenges. And I'll bring us back at 9 o'clock. And thanks, Brian. I know you're going to hop at some point. So if you do hop, appreciate you being here. All right, just for time, I'm going to bring up some themes I'm seeing and want to give you all an opportunity to give voice to it for clarification if helpful. But Stephanie, I'm going to pick on yours because yours is actually kind of the anchor for some of the themes I'm seeing down below, just since you're at the top. So the big one I'm seeing as far as, I'm just going to start with the, I think folks are pretty consistent on the benefit, so I'm not going to spend time there. I think we can take a variety of your comments and put some kind of commentary on that as it relates to like any sort of recommendations this group wants to eventually pull forward. So moving on to the second, what are the 3 key elements? The thing I'm seeing as themes are, 1, the education and training for the folks that would be doing the screening. The 2 would be a mandate. Actually, I'm thinking Dennis and Stephanie, seeing both of that very clear in yours, of like, this would have to be mandated. Otherwise, someone could just kind of say, thanks for the idea, but we're going to do something else. So this is, I'm seeing like a clear need for that to be reflected in regulations or laws. And then the third piece is just the fiscal impact or the fiscal implementation or consideration there. And Stephanie, I kind of want you to speak to that a little bit because I'm curious. I'm seeing the fiscal note for a couple of folks. I don't want to get into it from a challenge perspective, but if you get from like what would have to be true, what are you thinking there on the fiscal side?
Yeah, I think that, what would be true is, 1, that there'd have to be a law or regs that required the use of this tool and the implementation of this tool, which necessarily would cover cost, right? And, and I had a question for this group. I appreciate we wouldn't just take Illinois' tool and throw it down on the table and use it. And so there is a cost there, Trace. Like, what would this group even envision? How would we create that tool? So in other words, I could almost see a law where somebody's like, we want this tool and we're going to give a year to secure a vendor who will help develop the tool. So those are the hard cost of developing tools, training to tools, doing outreach and education and training to everybody, because it's not just facilities, right? It would be to foster families or to others. And then I think there's ongoing evaluation, which is something, always has to be built or should always be built into projects. It is not always. So those are the hard costs. And I think I come back to square one, to your point. We don't have to operationalize this. We have to conceptualize it. But those are my thoughts, sort of second step.
Yeah, and I think also, not to go down the rabbit hole of operationalizing, but I am curious because I don't think I see this anywhere. Would you all, would a recommendation to start a process like this, like Stephanie, you mentioned 1 of like the development of the tool would be 1, but then 2, like almost like a pilot rollout. Is that something that's often seen? And is that something that this group would be interested in saying, like, we don't need a tool to just be like broadly rolled out to every entity that would be using this tool, but instead we would suggest, some sort of pilot within these 3 entities, thinking like residential, foster homes, whatever. Is that something that folks are, or is that something that you all feel is appropriate also to recommend here? I'm just not seeing it, so I'm kind of wondering if that's a thing too.
Yeah, I mean, from my perspective, it is a thing. Whenever you're going to be using any sort of tools, particularly risk assessment tools, right? We have to make sure that the tool we create is the right tool, right? And that it accomplishes what we want. And so we actually wrote legislation on QRTPs on another issue, but that was the strategy, was to roll out a pilot project. I think at that point we said 5 facilities. And then there would be ample time to roll out, to fix, to tweak. And we worked with the University of Denver Policy Lab for that vision. And those were the steps that they recommended as social scientists, right? It's about getting input. It's about creating the tool. It's about watching the tool in a pilot project. And then, to the extent that there will be tweaking, which undoubtedly there would be, right? There's always poor consequences of policy that has never been implemented. That would be part of the rollout of the pilot project. So yeah,
Okay.
at least in my brain. Sorry, y'all. That's just how
Yeah.
my brain sees it.
No, I'm seeing a lot of head nods. So I think that we can also, I'll just put it in there as a note of like, again, of considerations and any sort of recommendations that would roll from this group. Renee, go ahead.
Yeah, my mind keeps going to in this conversation that I feel like we're talking about two different types of tools. I mean, screening and assessment connote two different things, and mostly what the discussion has been around actually sort of like an assessment tool, like identifying reasons, things that could build an individualized plan and prevent future runs, things like that. Screening tends to mean more like, is someone at risk, or what level of risk are they at? So that might be something that would be done, initially, or, for any youth or something like that, to determine, are they at higher risk for running? And I just wanted to raise that screening and assessment are generally mean different things. And maybe in our conversation, we can kind of clarify, are we talking about both? Are we primarily talking about an assessment tool right now? But
Yeah. And Renee, that's a super helpful, something that we can spell out as far as ensuring that it's clear that these are two separate things. So they don't get lumped into one of like, here's changes we're recommending. My question back to you would be, so let's say that we were just talking explicitly about screening tools. If you flipped it, would you have any additional themes that you're seeing as far as the elements that must be present for success in Colorado for both kinds of tools? It seems like regardless of the differences in the tools, those three things would still have to be true that we just named. I just want to make sure that I'm not assuming that. Is that?
Yeah, I think it's hard to think of them together for me. Yeah. Screening tool might be more universal. An assessment might be something that you do for youth who are at higher risk, and so screening might be less individualized, an assessment, or just more, kind of basic. An assessment tool, then I think there's different factors you have to go into. Like an assessment tool needs to have youth input, collateral from the providers, all some of these other things that we've talked about. But overall, I think it could be a single sort of unit, a menu of things to be done.
Right. But I'm hearing you on the need to spell out them as individualized pieces and tools. Cool. Thank you for that clarification. Anything else? We've just got a couple minutes and then I want to flip us into the challenges piece. I did my best at just naming the three themes I'm seeing on one piece, but anything that you either really excited about or you want to call out that you don't feel, Jana, I want to say, like, I see your piece kind of more on the, again, what you'd spoken to on the, where the focus is and the content piece of the tool itself. So just want to name that's appreciated as far as the actual development of the tool. I'm thinking right now, I'm trying to stick us more in the system space of recommendations for any sort of like implementation, but I think that's also a thing that we can also capture as far as what this group would recommend and what the group was talking about as it relates to the actual development of the tool itself. But I'm kind of separating those two just as a heads up. So not leaving out your themes, but seeing that as a different piece from the systems change element. So just want to name that. Anybody want to add anything though, as far as what they wrote? Dennis, I know you reflected, honestly, I think all three of those themes as well in yours. So from your perspective, anything that you would add or want to underscore or highlight there?
No, but my brain's already going towards like operationalizing it, because eventually that will fall to me anyway. So
sure, a fair thing. So we'll appreciate you just naming that. And I'm sure on the challenges side we can kind of dig into that. Renee, anything else? Looks like you just raised your hand again. So
yeah, sorry, I'm just the hand lowering and unmuting. I think for anything like this, then there's the how it's actually applied. Both that many people have mentioned the education needed around the tool, but then it's what you do with the information also after the information is gathered. That would be key. that would be a lot. I think that would need to be a whole piece around it as well.
Yeah. Thanks, Renee. Dennis, go ahead.
I would say too, around operationalizing, we're working on some other initiatives as well that could help operationalize this. So I think it doesn't, in my brain, it doesn't look quite as daunting as it might look like on this piece of paper, right? Like, for one thing, we're moving towards having a child welfare training academy for staff and facilities. You could utilize that to train the providers, right? So we have some things moving in the direction of doing this. But today we're hoping to finalize a recommendation to Child Welfare Subpac on a universal referral form for placements. The tool could be attached to the form, right? So I think this is pretty doable.
Yeah, and Trace, I would just add to that. I think that at some point it would be nice to list those things, right? Like, what are those items already in place, right? If we make a recommendation, also to have a column that's what infrastructure is already in place that can be utilized, so we're not creating redundancies and we can move faster. The only other thing I wanted to mention is that Congress actually has, there's a law that is called Stop Children from Running from Foster Care. Like, that's literally like the name of it. And they are going to be dropping down quite a bit of money to states for implementation of many of the things that are being discussed in this group. So I know that that's federal legislation and that's like on Mars somewhere, and who knows what can happen in Mars, but ideally, if that gets passed, there would be support. Again, another tool that could potentially really fill in nicely, specifically for this purpose.
Yeah, I love that. Appreciate you calling that out, Stephanie. I think what I'm hearing then is just the need to, it's that idea of like, there are so many tables that already exist. We're not trying to create a new table, but we're trying to ensure that there's a seat at the table for the recommendations that you all make. So Dennis, appreciate you kind of naming some of those entities, and we can kind of work together to make sure that we have a robust list of what's already happening and where this could fit in meaningful places and efficiently, if you will. All right, I feel like I'm frozen. Can y'all hear me okay?
Yes.
Yeah, we can hear you.
Okay. All right. I think it's just videos are frozen. Okay. All right. Perfect. Let's move on to, I'm just going to go off video because for some reason mine is frozen, but let's pivot. We've got about 15-20 minutes for challenges. And so if you scroll down on that document, you'll see a pre-populated name there. And so would love for us to spend 10 minutes filling that out, and let's bring it back to conversation. All right, let's would love to give voice to some of these. I think some of these are I want to name the tension of like not getting too into the weeds, but also knowing that there are unique challenges, and I want to make sure that I'm fully understanding. I think the big theme I see across is trauma-informed training. And will this create more barriers for placement is something I feel like I pulled out as a theme too, or the challenge of it. If someone is not trained properly and doesn't have that unique lens of trauma-informed practice in this assessment tool or in the screening tool, will that actually weed more kids out from good placements that might be a good fit for them because of something on the tool going awry? So that's kind of how I'm interpreting a challenge that I'm seeing in multiple folks' responses. Michelle, I'm going to pick on you a little bit because you have quite the laundry list here of things to consider. I know that obviously, again, kind of with the keeping in mind, not getting too into the weeds, but what are go high level for me a little bit. Like what are your main challenges, your main considerations here, given your unique vantage point?
I think I just feel like there's so many. I think we just, for a caseworker, right? Like, we fill out on average 15 referrals for one kid to find a placement for. And so is like, are we, and we're putting the same information in all these referrals. And so the screening tool, is it going to have the same information? Like what, I would want a really clear, like, understanding of what is different on that screening tool than what's in this information I'm giving you. Because I don't want more work, right? To fill it out 15 times. Yeah.
Can I ask a clarification there? So if I'm a caseworker and I'm filling out 15 referral forms, is what I'm filling out that's already happening at the county level, is that something that you all created? Is that consistent county to county? Like what's the consistent, so like in your county, for instance, like I hear you on that. Is that something that is happening in every county? And is that what they're filling out and the questions, maybe you have, let's say 15 questions you're asking a caseworker to fill out, or there's the same 15 questions that are being asked in different
It's like
counties.
a
So
package. There, it's sometimes like a plate, like a placement. I'm not gonna name a placement, like, you know, Third Way, Southern Peaks, like that you will have to send them. Sometimes it's 15, 20 pages of information. Some of it is information we pull, right? Like we just print it off, right? Like placement history, you know, evals, things like that. But like we are physically having to go in for each of these placements and fill out the same information, because one is for Southern Peaks, one's for Third Way, and then now we're going to add in a screening tool. But then like also when a kid runs, like we have things we have to do on our end as well. So it just seems like, you know, we have to do the HRV tool. We have to enter all the stuff into trails that we do. Like, I just want to make it, it seems, I just don't want to duplicate the work. I want it to be intentional around what this tool is going to look like.
Yeah, so what I'm hearing from you is not like, no tools, you're not saying like tools are bad, let's just like feel it out, but you're saying like, let's do an actual, we have to be intentional about this. So it's kind of what Stephanie was talking about in the last conversation, which was like, there are things that already exist, and do we know what those are? And how do we ensure that this is part of the, moving us towards efficiency and not towards duplicity? So yeah.
The other thing I think is really big is that we're sending so many kids out of state because we don't have placements here. So how does our tool here then work with an out-of-state agency who has their own process?
Okay. Yep. How is it like beneficial to them, or is it actually being utilized? Yeah. So I think even, you know, you're giving like 15 questions here, and I'm kind of pulling it up to this broader theme though of efficiency, effectiveness, and making sure that it's not just someone being like, here, people at the county caseworkers, and the caseworkers, like, it's another policy where people are like, cool, thanks y'all. Like this just added to my paperwork amount significantly. So I'm hearing you on that. Dennis, go ahead.
To Michelle's point, that's the reason we're creating this universal referral form, so that you only fill it out once. And then after we're done with the stakeholder process, and if we needed to add the tool to the referral form, I think that's a pretty easy thing to do. And then there will be a rule that basically stipulates that providers are unable to accept a referral that is not on the unit, that is not on that form, unless it's like from a parent, right? But like from a array or from a county, the only way they could accept the referral is through the referral form. So a county would only fill it out once and then send it to different various providers.
That is amazing. That would make my workers so happy.
Well, Ruby Richards will be in the meeting later today, and Jermaine Meehan will be there too. So
love it.
We love that. Stephanie, were you going to jump in?
Yeah, I was just going to say, I mean, I think that, you know, with any policy change, all of these considerations need to be brought into the fold, right? So again, I think that, you know, to your point, Trace, it's the question today conceptually is a tool like this effective? Operationally, again, you would build into a law a process that would bring in all of these concerns, again, all the existing infrastructure to the extent it exists, and blend these things together, right? So I just want us to, I think it's very important to list, you know, what Michelle's concerns are and use that, right, contextually in any sort of recommendation you would say, right? First work would be reconciling all the existing processes and forms that go to youth who run away, right? And then determining a tool that there's a gap, because we know there's a gap. I mean, I can look at these tools and go, Colorado's missing a whole lot of information. So I think that that is something that just can be built into the process and should be, rightly so.
Thanks for that, Stephanie. Go ahead, Renee, jump in.
Yeah, I think, the Dennis's point, it seems like it should address the kind of initial screening risk assessment. And then it seems like for a post recovery assessment, it might be useful to have a process flow map to look at the things that Michelle raised, all the other things they're doing, and make sure that whatever is created, fits in well, like you're saying, Stephanie, about, process flow map might be a way to kind of look at that and really figure out the best way to recommend something.
Yeah, I think we'll have to count on you all as we kind of put this into a succinct narrative of considerations, right? And making sure that we're naming those explicitly. I think, Michelle, like to my point with you, it's like the operationalizing of that can get pretty in the weeds, but the general sentiment there is, at each county level, how are we ensuring that the folks that we already know are getting burned out, i.e. our caseworkers, the folks kind of doing this work and doing the implementation work are seeing this as an effective tool, and, also perhaps some interesting opportunities there to almost in the pilot, if we recommend it from a pilot perspective, to get feedback, right? To recommend that is something that, that this group, wants to recommend, that we actually hear from caseworkers themselves in this, in your particular case, or residential folks, or, whatever it is. What's the feedback loop there? So that could be its own thing to pull out. Stephanie, I'm kind of looking at you of like, that this group is saying in all of these recommendations, another recommendation, another thing to be thinking about is, what is our feedback loop opportunities here? And this group has really highlighted the need for that. So just put a pin in that one. Anything else here on the challenges? The other group's about to come back. I want to make sure that folks, Jenna, I know you kind of were keeping your notes to yourself for technical reasons. What surfaced for you? What are you thinking about? I want to give you a chance.
I was able to paste them in. And I realized some of my barriers is part of my additional comments, but I was just also commenting on the whole just piece around being realistic with staff shortages and how much time it takes to get trained in these best practice assessments. And for one of our assessments, if it's a really good interview with a youth post run, it can take an hour and a half, 2 hours. So I think being realistic with that. And would you ever, and I didn't write this and I can add it, would we ever consider, incentives for staff to get trained and these assessment tools, and having super assessors, right, in residential facilities. So those are just things kind of I think of as I look at my current staff and their workload, and just knowing staff shortages. That was kind of a big piece for me.
Appreciate that, Jenna. Ashley, Kevin, Jana, Chelsea. I'd love to hear from any of y'all. Anything else for us to be keeping in mind from your perspective?
Sorry, can I add one more thing?
Yeah, please do.
And again, I know because I speak from a foster care lens, but I'll just put it out there as well. And I put that on here. We can't restrain, youth and foster care. We can't lock the homes. We don't have seclusion rooms. So there's different things that we have to look at for prevention for kids running in out of foster homes. So just something to keep in mind.
How often does that happen, Jenna? Do you have any idea how often kids run from foster homes?
Nightly. And we're not a huge program, but we have a lot of AWOLs. Yep.
Just didn't have any concept of that. I mean, obviously I don't see how you could have a kid with a propensity to run in a foster home. So
yeah, I mean, unfortunately, right, with FFPSA and we've closed so many beds, they have to come in foster homes. There's nowhere else for them to go. you know, I think something to keep in mind is that they will run and they'll return the next day, and that's great. And they still ran, which puts them at a really great safety risk. And so we have to go through our process of assessing that and, you know, kind of trying to put the best plans we can in place. But yeah, it's a pretty chronic problem. And I don't think we're the only CPA that faces that.
You're not. It's more common in foster care just because there's the sheer numbers. There's more kids in foster care than there are in facilities.
Yeah, makes sense.
Well, appreciate y'all naming again the unique challenges that you see from your perspective. Bringing it back to the opportunities piece, I'm encouraged by how much, even just visually, there's a lot of opportunity here. It's so excited to kind of like bring that together into more succinct kind of presentation to the group. So with that, want to end on who would like to volunteer as the person who's going to work with our team and Jordan and Brian to kind of bring this conversation to the larger group at the next task force meeting in January, which will include just kind of summarizing overall, but also some actionable steps that this group has. So, you know, again, summarizing those themes, et cetera. So we're not looking at a ton of work, but would love for someone to volunteer. Otherwise, I'll run my Wheel of Fortune wheel I have over here and volunteer someone. Who's it gonna be? Renee. Ashley. Renee, you're saved. Ashley from left field. We love it. All right. Thanks, Ashley. Really appreciate that. We'll kind of rotate folks. And I'm guessing after our first one, you'll see, okay, that wasn't so bad. But really want to give you all the opportunity to bring voice to these unique conversations and challenges and whatnot. Again, we will, the recommendations don't come from the subcommittee, but back to the larger group for them to consider. But really, this group is kind of doing the work of saying, okay, we've looked at the resources and we've had the conversations. So appreciate y'all. I know most of you had an opportunity to look through the materials, not all of you, but really appreciate that. And you're going to have a ton more resources coming your way for the next conversation as well. But in January, we'll just be a recap of this conversation and then hopefully moving some recommendations forward. So, all right, with that, the other group should be coming back any minute. I'm going to just say, let's take a talking pause. If you have any notes that you want to enter that you weren't able to, go ahead and do that. And otherwise the group should be back soon. So feel free to go off video and we'll be back in the next couple minutes and we'll kind of share out from each group. I might volunteer. Let's see. Michelle's like, I'm off video. Jenna, I might have you share out from the group from today if we have a little bit of time. And then we'll do public comment and we'll be finished for the day. Thanks, y'all. Welcome back. We got a couple folks still coming in. All right, cool. So we've got a little bit left. I want to just say if there's anybody on the call that is a member of the public that wants to provide public comment, please drop me a note now so I make sure that we save you enough time. Otherwise, Doris, would love for you to volunteer someone in your group how to go. Tell us, I know we're going to hear a lot in the next meeting, but would love just a quick high level. How we doing over there?
Yeah. I'm gonna call on Beth to give us a quick recap, in part because she's gonna be working with Jordan on preparing the summary for the task force. Beth?
Yeah, I think we had a really good discussion today, this morning surrounding whether or not this should live with law enforcement or someone else, and then really identifying whether or not the response is this unit going to be able to respond within the hour, or is this something more long-term? And then really wanting to identify like the why behind it and what's next. We also discussed, when meeting with that youth, whether or not it can't just simply be returning them back to where they ran from. And whether or not that needs to be a hospital and receiving clinical services overnight or multiple nights, or if that's not necessary, but still needing to kind of have a location where they can reset and having a safe place to go to spend the evening so that, again, they're not just being brought back to that location and then going back on the run. Doris, am I missing anything? I feel like it.
No, that was good. Thank you, Beth.
Appreciate it. Let's come over to my group. I like that theme. Jenna, I was originally going to pick on you, but Ashley, are you feeling, is your kid doing all right? Are you ready? Are you in a spot to jump in? No. Okay. All right, cool. So Jenna, I am going to pick on you. I'm like, is your kid better yet?
She
You're
was like,
no.
she was like, no, you didn't just ask me that. I'm with you, Ashley.
It's a mess
I didn't know
over
if it
here
was
right now. It's a total mess.
okay. You're like, do not make me come off mute. All right, cool. Jenna, I'm gonna pick on you then on behalf of Ashley, if you wouldn't mind sharing a little bit, again, just kind of high level with the pre-screening tools, conversation and assessments.
Yeah, I'm happy to cover for Ashley because she volunteered for the other big piece. So thank you, Ashley. Yeah, so I kind of went through and summarized our notes. If I missed anything, let me know. We talked about the opportunities and kind of barriers about implementing these preventative measures. I think with the opportunities, one of the big kind of overarching themes was that it was very youth-centered and really trying to understand kind of their why when we're utilizing these screening tools, and the screening tools providing consistency kind of across facilities and evaluating the risk. Some of the key element for opportunities was we definitely need training for those that are going to be implementing these pieces, and then laws and kind of regulations around implementing these tools and assessment statewide. And then regarding opportunities for the actual tools, I think a lot of people hit on kind of Illinois' model. There were some call outs too for Georgia and Nevada, their models, and then just really ensuring that Colorado's kind of unique needs are also brought into what those specific tools are going to look like. And then some of the kind of overarching barriers were just like the financial piece. How do we implement these certain things? You know, whether that be what we talked about, like the actual hardware into the facilities, and then kind of staff time and cost for getting these tools and then training them. And then on kind of the same side of the staff piece, like the time and effort putting into training and conducting these assessments. I think that was kind of our overarching themes for opportunities and barriers.
Crushed it, Jenna. Up top, high five. Love it. All right. So anything, well, actually, sorry, anyone from the group want to add anything? I was saying she crushed it. All right, cool. So again, we'll be coming back in our next meeting in January with our it sounds like Jenna, or sorry, not Jenna, Ashley. If your kid gets better, listen, and Beth, we'll be working with our team on just kind of more deeply summarizing things and bringing things forward that the group to consider around recommendations. And then we will spend our entire meeting around these two topics, making sure that we get to a kind of a buttoned up place as far as the group goes, and then we will move on. So excited to do that. Excited to kind of make some progress there. So, with that, I don't have any notes about public comment. And I'm certainly not going to keep you just for the sake of keeping you. So I want to remind you that we will be back on January 3rd with that next conversation. It is super important that we are at each of these meetings. I'm just going to reiterate, because particularly if there are voting around recommendations to move things forward, we need you all here. So thank you for being here today. And the next round will be January 3rd. And with that, Stephanie or Beth, as co-chairs, anything to add before we say happy holidays and happy new year to folks?
No, just happy holidays and happy New Year's to folks.
Perfect. Well, we really appreciate each of you and hope you have a great holiday season with your family and friends. And yeah, we'll see you back on January 3rd. Thanks, y'all.